And thank you for joining us once again for the Cultural Competency Enhancement Project's Transformational Change Agent meetings. Today, we are doing the pre-work for the Strategy 2, Defining Your Organization's Change Management Culture. How will you change it? In this preceding video, we're going to go through a couple of agenda items pertaining to how to define our organization's change management culture, understanding how to identify your organization's change management culture, identifying your organization's change management culture, and taking back operational tools to your organization. Before we begin with new material for pre-work pertaining to the types of cultures within organizations, we'd like to have Dr. Rudnick join us again to facilitate the why of Transformation Change Agency on, again, a refresher on towards inclusion. Dr. Rudnick?
Thank you, Sunny. And thank you again, folks, for doing this work, for being part of this learning experience. I think it's important to state or restate that this work is challenging for a number of reasons. And as we do the work, it's important for us to recognize that this is not about pointing fingers or to tear individuals or our organizations or our communities or the fields that we're in apart. This is really to help identify what are more appropriate, healthy, constructive ways that you as employees, as members of an organization that's doing good work, that's doing necessary, essential work, to find appropriate ways to observe the culture of our organization so that you and your organizations and everyone that is a stakeholder, your community members, your coworkers, your supervisors, can best respectively and collectively assess how can we do things better? Where do we have some gaps, right? So sort of an applied constructive criticism, but it's not intended to point fingers or to place blame. And really the way to do that is one of the major ones is to leverage different perspectives. It's important that most organizations have some degree of knowing who is accountable for certain decisions to be made, so there is follow through and that certain responsibilities are covered. If someone is out sick, right, we know who is ready to jump in. If there's only one person that is able to sign off on a form and the weekend comes and that person's been out sick, those kinds of things can be challenging, right? So how do we leverage a shared understanding of what everyone brings to the table, and perhaps other ways in which we are not fully leveraging what everyone brings to the table, right? And we can't do that. We can't ascertain what we could do unless we can understand what everyone might be able to do. And that might help us start thinking a little bit outside the box. I imagine many of us have had to be extremely flexible, as well as our organizations these past few years, without reducing it to putting the silver, what is it, every cloud has a silver lining. There are ways in which we can think about how we have had to be innovative, how we have had to be creative to adapt, to not necessarily thrive, but to survive a lot of the challenges that have arisen in the past few years. How does that extend itself to our decision-making process, and who are part of those conversations, right? Is it the folks that are most impacted by policy decisions, by the norms of how your organization runs? And for those that are leading your respective organizations, what might you do differently? That it's not just a surface level, I'd like your feedback, but really cultivate a space where there's buy-in, and folks within your organization feel like their voices can be heard, their needs can be met, and frankly, from a business standpoint, those are the kinds of cultural shifts within an organization that's going to retain employees. in many cases more than even a salary, which lends me to the next point around hiring, satisfaction, and retention. What are we doing as our organization that we are making sure that our processes for bringing folks on board, the search processes as a whole, are equitable and fair and inclusive, mindful of the specific identities and circumstances and experiences beyond what we might dictate or determine as normal. How do we keep folks around? Knowing what burnout and related factors in a challenging fields such as mental health and addiction, right? How do we keep folks around? What are some ways in which your organization can make folks feel that they are part of a community and a shared sense of shared fate? How do we tend to both the personal and professional health of all of our employees, right? As well as that of the community members that we serve? How do we engage with our clients and the communities, understanding that every community and every client they're in is going to look a little different? How do we work towards inclusion with community members and clients that we are very familiar with, or at least folks who may fit their description? And how do we engage with those community members and clients that may have identities, experiences that may be unfamiliar to us, that we might have some ideas about? How do we identify what resources are necessary? And then how do we advocate for those resources, right? It might be one thing to name that, well, I think our organization could use another $5 million. That's wonderful. But in truth, I want to edit this last part because I'm stumbling over my words here. It's 3, 2, 1. When we talk about resources, how do we identify what appropriate resources are needed in our community, and then how do we advocate for them? For example, there may be an influx of certain community members that predominantly speak a language that is unfamiliar to many of the folks in your organization. What pieces of paperwork are readily available to translate into other languages? Are there ways in which your website, your organization's website, might have translation, right? So it's not about pulling blood from a stone, but it's really being mindful of being responsive to the needs of you as an organization and the community that you serve, and having that adaptability and that flexibility. And that doesn't just say inclusion, that actually shows and models inclusion, and it is a process, and that lends itself really to solving problems. Implementing these kinds of cultural shifts and being really collectively intentional, I want to lovingly suggest will go a long way and a strong way towards reducing or at least mitigating many of the problems that organizations tend to face, because you're actually leveraging a broader, deeper degree of expertise and buy-in and insight. So it doesn't guarantee that problems are going to be solved, but it certainly enhances the possibilities. The work of inclusion is not a microwavable meal. It takes time. It is complex emotionally, intellectually, oftentimes politically, and the challenges towards inclusion are numerous, and it oftentimes might feel insurmountable. Demographic shifts along a number of criteria, right? Nationally, internationally, in response to certain crises happening even globally, things that might not necessarily touch our neck of the woods might all of a sudden be in our backyards. In shifts in immigration with respect to young folks in particular feeling more comfortable with their gender identity. There are a number of shifts that are happening, and it may occur from an employee standpoint within your organization. And it certainly may show up in terms of the clients and the communities that you may be a part of. And then recognizing that even if you live in an area where it might at surface, at first glance, appear to be homogenous, recognizing that there is a wealth of diversity even within those spaces, even if we are not necessarily framing what we mean by diversity in sort of typical ways. There's the lack of understanding or valuing difference, right? Many of us have been raised, and myself included, with the idea that the way that we deal with difference is to not think about difference, not feel about difference, and don't do anything about difference, right? Just treat people like people. And so when issues that bring up difference, to say nothing of inequity, to say nothing of exclusion, are brought to our attention, it can feel untoward, not just because the issues are hard to wrestle with, but in many ways, we have been encouraged to think, feel, and discuss by not feeling, thinking, or discussing. And so we tend to reduce or push away or refute or rebuke real challenges. And so I'd like to invite us to think differently. What might it mean if we were to do the work to actually embrace difference, not as a means to an end, but as something to be leveraged, respected, empowered, embraced. And this is hard in many ways because even if on the individual level we had no angst towards other community members, folks that are like us and not like us, we have inherited systemic inequities, right? We are living the legacy of that, right? No one on this call, in this webinar, is responsible for assuring that certain communities were segregated and stratified from one another, right? No one on this call is solely responsible for ensuring economic depravity in certain areas as there were certain economic shifts, right? No one on this call is responsible for the rise in certain communities of opioid addiction, right? And yet here we are. And so wrestling with things beyond an individual level when we understand that many of these issues are systemic in nature can be quite challenging. It's wrestling with our own biases, right? Knowing that it is more significant, more severe than just whether or not you are a good person or a bad person. If you are an intelligent person or not an intelligent person, that biases are part of what we do. It allows us to not have to write down that 2 + 2 = 4, but also if we have received false information, we might very quickly determine that 2 + 2 = 5 if we have been provided wrong information, and that wrong information has been reinforced at every turn, right? Knowing that can often lead to discrimination for certain community members and microaggressions, whether or not there was intention behind it, although in many cases there are still overt, explicit forms of discrimination and microaggressions. Knowing that things like microaggressions are not referring to certain events being minuscule, but really just at the level of exposure, right? And it's the constant exposure and experience with these issues that both our clients face and that we may face ourselves or may have colleagues that face an experience within our organization. And again, one of the challenges is you may not experience something in the same way that someone else does, or you might experience something that someone else may not. Or maybe you've experienced it one time and someone else has experienced a thousandth time and can't relate to one another, right? We're all coming at this work from different spaces and places. And so how do we honor that when we understand something and even when we don't? And then just to name that, we've been socialized, right? It doesn't mean that a good or a bad thing, but we've inherited ideas. We've inherited institutions about where we're at, the folks that have taught us ideas about the world, about one another, And we live in an information age where we're often privy to information, to ideas, to individuals that we might have had different ideas about. And so this can lend itself to a challenge, because it's one thing to shift our attitudes, right? Do the work of shifting our attitudes. It's another entirely to change our behaviors, right? As a quick example, as someone who was trying to eat healthier and be healthier every morning, when I pour the creamer in my coffee, I am mindful that I need to stop at a certain point if I want to be healthier. That's my attitude. My behavior is when I stop pouring that creamer. And so working towards an alignment of our attitudes and our behaviors is one thing, but, in theory, but actually doing that requires practice, patience, and time. And then finally, communication. How are we talking to one another? Whose voices are being heard? Whose voices are not being heard? Whose needs are not being met? When you have your staff meetings, do you just follow Robert's rules? If you do and if you don't, whose voices are being left out of the conversation? Who's being talked over? Or perhaps is made to feel that they can't fully participate. Again, this is not to indict an organization, but these are things to pay attention to. That are worthy not just to the folks that are most aggrieved in these situations and these spaces, but knowing that this ultimately hinders the growth, the thriving, the success of your organization as a whole, right? And doing this, it's so much easier said than done, right? But without the actual work, our organizations certainly cannot live up to what we are capable of.
Dr. Rudnick, thanks for that encompassing review and restating the why of Transformation Change Agency, and really looking at this overall learning series to be a continued push towards organizational adaptability and individual accountability on working mental health and addictions provider organizations towards inclusion really every day and through each person that is interacting with our providers. I want to take a moment to transition now to one of our key objectives, which is identifying what company culture is and the type of culture that your organization has today. It's really important to be able to define the type of culture of your individual organizations, because that type of culture will give you some data science and also best practice understanding of how your organization will actually support change management and how organizationally that change can be adapted to then provide that external messaging, service excellence, and support to your patients. So we're going to use a very business construct for the definition of company culture. In your pre-work, there is an article link on the email that you access this video through to the Harvard Business Review article regarding the types of company culture. Now, generally speaking, in a business environment, we do actually have 8 different types of company culture, but I selected only the 4 that have the most relevancy to mental health and addictions providers. And these are the clan culture, where members have common interests and perceive themselves as part of a large, dynamic, and interested family. The adhocracy culture, where employees are encouraged to take risks and executives are viewed as entrepreneurs or innovators. The market culture, based on competitive dynamics and producing tangible results. And the hierarchy culture, structure and control are the cornerstones of this type of company culture. We select these specific company culture types because we actually have really kind of exemplarily case studies or examples of organizations within our communities in mental health and addiction provider designations that really exemplify these types of cultures. So I'm going to welcome Kelly and Dennis back to be part of this conversation as we kind of explore the clan culture. So, Dennis, Kelly, whenever I'm on site with a mental health and addiction provider, I'm always I can always tell when I stepped foot into clan culture, basically on the first foot in the door, because you see individuals that are grouped together, chatting about the overall improvements and support, and just acting like the environment feels like you've stepped into somebody's living room. And the interactions of all the staff members are incredibly collegial and incredibly supportive, and just warm and compassionate. What other examples of clan culture that you all have observed?
That's a really wonderful question, Sunny, and feel free to jump in, Kelly. I would say my current space where I work in for the majority of the time, I'm an assistant professor in the College of Education at Missouri State University, and within my department, and certainly throughout the college and in many ways across campus, there is a shared fate. And I think the word family is thrown around a lot. It has to be lived. It can't just be on a mission statement. And I think a lot of that is there's folks that are smart and good at what they do, and very talented and all of those things. And they're kind as well, but they're very purposeful in understanding that the ways in which some of us communicate might be very different. And I would also make the case that the work that I have gotten to do over the years with you, Sunny, with you, Kelly, and some other folks, very much also feels like a clan culture. We have different strengths, different backgrounds, different experiences, and I think we attempt to leverage that. And there's a shared interest in getting the work done, but there's also a shared interest in what we need as individuals, right? That there's understanding that the split between the person and the professional is necessary for the work getting done, but also the synergy of the person and the professional is also essential for the work getting done, if that makes any sense.
I think that's such a incredibly both poignant and also impactful differentiation, that we can separate our professional selves and our personal selves, but that we can only do that when we're given the permission and the safe space to do so. And
Right.
I thank you so much for your friendship in allowing us to have this clan culture in this wonderful learning series for Cultural Competency Enhancement Project. And when we have clan cultures, the opportunity to be innovative, explorative, and also incredibly purposeful and nimble at the same time is really maximized throughout the organization. So I think those are fantastic examples and insights into the benefits of clan culture.
Well, thank you both for just, really warming the heart there as well. This is Kelly, and I love that spirit when I travel to facilities, to agencies, and it's that team. And when we think of team instead of clan, or synonymously with clan, there's an extra pride. There's a readiness to jump into the work and to know that, hey, I'm part of something really great. And when we see our team leaders within the big team as well, it's just very exciting for me. So when we can develop that even within units within the agency, it's even all the more exciting.
I think that's such a great, insightful comment about how small teams can adopt clan culture within an organization. I think that's a really great opportunity to say, how do ideas that may be riskier, ideas that may be not aligned with the strategy of the organization, could be essentially first test bedded within a smaller group. Those are all great examples of really positive clan cultures. Now, there's the other side of clan culture where we look at common interests and the being a part of a whole, that belonging. when you have a very strong clan culture in an organization and you're going against the grain, you're introducing an idea that you know the clan is not going to be embracing, that you know is going to be controversial or is going to be not following the standards and the overall strategy direction, or really even the direction of where the clan wants to go, that's where clan culture can be very limiting in its cohesion. So we certainly have seen that type of clan culture within our mental health and addictions provider world, when we have certain regulations like syringe exchange program being supported by federal harm reduction policies, but not necessarily being supported on the state level or in specific legislative focuses. So when we look at clan culture, there really is some areas where we look at and say, well, we're trying to account for new and innovative that may not be part of common interests of clan. Clan culture as a company culture, then it is going to be the actual barrier to change management. Dennis, Kelly, any thoughts or comments on that?
I think if we look at things like our approach and how we introduce something that we know is for safety and for the betterment of folks. Like if we look at things, for example, speed limits, or when we're driving a car, people don't necessarily like them, but they do keep us safer. I am old enough to know a time when seat belts weren't even in cars, let alone be a law that you had to wear one. And it was a very strong, it was very difficult for people to embrace. You mean I have to put this on? I have to wear this seatbelt? But I think hearing over and over how much they have saved lives, or how much safer and better folks are, it has become more of the habit and more of the nature of what people just automatically do. Not to mention that their seat ding ding dings if they don't. But I think it's all about our approach and the introduction of how we might want to change something, and not just coming in forcefully and saying, here, absolutely, today, this is what we're doing, blah, blah, blah. Even when people went from a smoking to non-smoking culture in the workplace, we put things in place that were even classes and support groups where people could go for smoking cessation help, knowing they wouldn't be able to do that through the day. So I think as long as that introduction of how we want to do any type of policy or any type of change, or any type of that, is giving the good evidence and the reasoning why we're doing it, introduce it more than once, and continue to reinforce that good piece would be my recommendation.
I appreciate the good analogy on the seatbelts and the adoption of seatbelts as a policy, because it's a great segue actually to the adhocracy culture, which is really our most nimble and innovative organization. So here in the adhocracy culture, we're really seeing some exciting mental health and addiction provider ingenuity when it comes to those organizations that have adopted the newest and latest models, like mobile integrated response teams, like medication assisted treatment, and also any of the latest division of mental health and addictions models that have been promoted as evidence-based practices in the latest pilot innovation grant rounds. These are organizations that are really at the cutting edge, wanting to identify new improvements, areas of innovation. When you look at mobile integrated response teams itself, it's really creating an entire additional operating culture and also integrating all the different departments into a direct community outreach program. And so adhocracy culture is one that is really looked at in how do we, if you are an organization of this type, how do we continue to improve the mental health and addictions provider world in being able to continuously provide more and more anti-stigma, direct community outreach, immediate intervention type programs that blend both intra-departmental staff and proposes for non-traditional workforce participation along the lines of law enforcement, public safety, corrections, and judiciary being partners, and more when we look at how our existing models and programs today need to be transformed when working with youth, when working with other populations that we are not traditionally serving or primarily serving today. So adhocracy culture is really exciting, as I think that there's a lot at the forefront of combining medical care, mental health, substance use disorder, behavioral health, all of the silos that we've been operating in based upon transactional-based healthcare for many decades to this new transitional holistic based of caring for the whole person. Dennis, Kelly, other sentiments to share regarding adhocracy culture?
I think where it can go well is the part about innovation. Sometimes it can take when I've been in spaces where I've seen this where there's almost no accountability. Folks are encouraged to take risks, but one, they'll either take the fall if things don't go well, so there's no safety net. So there might be language and discourse around this is an organization where you can speak up until you're not, until either the repercussions of what you said or the policy that's implemented, if things go wrong, you're going to take the blame for that, or there might be the idea of risk taking, but you're really not supposed to talk. You can talk that way with one another, but not necessarily to the chief operating officer. And so to be mindful that risk-taking and ingenuity and innovation should be encouraged, but I think part of that is I think Kelly's seatbelt analogy really fits here too. Like those things are in place for a reason.
I think what's important here is kind of a risk management with the programs that we do. We have to encourage that innovation and trying something new that's for the betterment and the good of everyone. But as you mentioned earlier, doing something just kind of spirited and off the cuff is not in. When you're in the human being business, we have to think of safety and our human being first. And so as long as we have our monitoring and our we're gathering our data, and those data are being applied at every turn, and we're really analyzing the work that we do, we are opening a door to maybe something new and exciting. But then it also gives folks who maybe aren't quite the risk takers, but they certainly they would have liked to have done it. It gives them the confidence to say, whoa, okay, here are the data that I was looking for that says, yes, I can do this. And then they can be a me too, and they as well can do it. But I think if we're not documenting everything that we do and doing it with purpose, this one is a little bit scary, but yet exciting at the same time.
Great recommendations regarding the excitement, but also tempered with good standards and good overall process and procedures. When we look at our next company culture of market culture, we're looking at competitive dynamics and producing tangible results. A translation of that into the mental health and addictions provider world is really looking at what is the demand for mental health services and how do we increase capacity to support that demand. That demand has been overwhelming even prior to the pandemic and has become a multiplier effect given the impacts of the pandemic. So when we look at market culture in relation to mental health and addiction providers, we're really continuing to push a huge boulder uphill and fighting this battle that seems insurmountable and never ending. So what I would recommend from a market culture perspective and when you're observing your organizations and kind of determining what the company culture is really looking at if your organization is very driven on specific how to support patients as customers, taking a look at, do we know what our most highly used services are? And do we know how those services then translate into ongoing sustainable care and services for impacting not only the individual, but the individual's family support structures and so forth. When we look at market culture-based organizations, we do have several that are doing some really exciting things in opening clinics in environments that are predominantly rural, predominantly supporting minority communities that may not have had access to mental health or may not have reached out for mental health support based upon cultural taboos and so forth in the past. But looking at an opportunity in having those clinics and physical facilities be expanded is an example of a very market-driven culture where the company goes based upon the need and goes based upon where the market definitions of what those next services, next supported demographics and constituencies are. Market culture is very, very difficult to sustain and be scalable with in mental health and addictions provider organizations, especially with the reduction of resources and the lack of access to tools that can expand, such as comprehensive telehealth, reimbursable support services towards telehealth, to account for really allowing our practitioners to do their most efficient and effective work. We also look at this particular environment in examples of mental health and addictions providers in being able to really touch point with patients as customers and as patients, not only getting feedback on how was the service and patients either not providing clear, honest feedback because there are a very limited number of providers in the field, or patients not being able to compare services because, again, lack of availability. Market culture, along with hierarchy culture, where the structure and control of company culture is very, very rigid, are two of the areas where in mental health and addictions providers support are where most of our organizations fall today. What we really want to look at and see a shift of a blend of cultures in exacting how company and organizations should be able to play different roles in the support of their employees, staff, patients, and community. So with that said, I'm going to transition to a very behavioral and the personality of an organization's view for what company culture is. And so given that, we're going to take a look at a specific framework. This is also in your pre-work reading, the Cultural Alignment Framework, which was created out of an analysis of personality types of individual leaders, managers, and employees in the general business context, conducted over several decades, and creating this Cultural Alignment Framework that ultimately identifies the role of the organization and its culture as the organization is interacting with their employees versus their customers, in this case patients, and then ultimately their communities. And so we look at 4 areas of interdependency, which is flexibility, independence, stability, and interdependence, and then 8 composite factors that showcase the categories of the type of behaviors that are exhibited based upon the personality assessments of the individuals within the organization, and then the organization as a whole in its adoption of those behaviors as it's marketed externally marketed message and branding. So those are on the flexible and interdependent side, purpose, caring, order, and safety. And then on the interdependent stability side, the learning, enjoyment, results, and authority. And so when we look at an organization that's very authoritative and safety bound, those are organizations that absolutely looking at stability. So organizations in the mental health addictions provider field that would really emphasize and be specific to this would be our psychiatric hospitals. When we're looking at results and enjoyment from an independence organization type, we're really looking at the construct of the majority of our community mental health centers, as their primary focuses are results-oriented, reporting to state, HRSA, and their specific patient satisfaction survey results in looking at services and support. When we look at examples of flexible organizations that have a high learning and purposing, we're really looking at our social work academic institutions that are supporting student practicums, having students collaborate with organizations in the field. And we look at the order and caring component in our mental health and addictions providers. We're looking at really how our behavioral health centers and organizations are really adopting and adapting our licensed clinical social workers and our therapists and psychologists as a representative face of the therapies provided, but also standardizing that intake and interaction and ongoing appointments to account for the structural whole of our mental health and addictions providers. As we look at this kind of company cultural behavioral health cultural alignment framework, I want to then blend the two from the top 4 types of relevant culture types for organizations and this continuously evolving behavior scale, and show you a visual of what that looks like when you lay those 2 models on top of each other. And the key point in this is that your organization from a company culture is ever changing and at the same time leaning towards a specific type of culture, but exhibiting all cultural behaviors, and the ability for it to shift into another cultural type is both indicative of the type of change management, the particular topic, or even the particular employee grouping that is asked to lead that change. And so with this, when you look at how our company cultures are very fluid, this gives you hopefully encouragement to showcase and say you can identify the predominant culture type for your organization and the specific personalities that attribute to that culture type. And then through that identification, the ability to really start tracking and evaluating how change management could be adopted, whether it speaks to, yes, this is a very innovative, great new model we should try for our adhocracy teams, or absolutely this model will ensure safe practices, is evidence informed, and will account for our stability in our processes and programs going forward for our organizations that are very hierarchy and market driven and supporting. So that was a fast track on cultural change management in identifying the types of organizations and the behaviors that the organization exhibits based upon the composite of personalities. As we go into the next objective, we are really going to leave you with some tools in thinking through all of the information that you just identified in your pre-work.
So I think just looking at that was like, oh, did we ever say, oh, we are really overworking this group of folks when this group could maybe pick up a little slack, and we could build different components maybe with different staff, integrate different staff, make a better continuum of care. It would be very curious to see how some of the results of your time studies, if you really started looking at some of our activities and some of the new initiatives that we're trying to create. And at the same time, I'd like us to embrace some other thoughts as we are engaging more and more paraprofessionals into this work and assigning work duties and that sort of thing. We have to have and establish the balance between making sure that they are not engaging as a licensed practitioner, but still feel that very, very valued part of the team. And that's a very important but hard definition to come by. And I think that that also helps create our culture as we really sit down together to say what each group needs to feel as part of the team, but also making sure that we have our licensed folks knowing they're the licensed folks and making decisions based on that licensure, and our paraprofessional folks are making other decisions or recommendations or help or support within the confines of their role. So those would be a couple of important factors that I think are worthy of considering as you look at your company culture.